So yeah, that's a good idea. So let me see if the recording is started or not.
Yeah, it started, sir.
Started? Okay. All right.
Yeah.
Okay. So, well, the whole idea of this talk is because a lot of people have been talking to me about fellowships. And the general feeling I got is that you guys know very little about it. And you kind of are trying to shoot an arrow in the dark, hoping to hit the bullseye. Okay. That's the feeling I get when I discuss this with a lot of people. So that's why I'm going to now go through with a lot of things. Some of it may actually hurt you personally. You might feel that, why is Sir saying things like this? But a lot of things are meant to guide you. Okay, so none of this is meant to hurt you. It's all meant to guide you. So the fellowships that are available to us are at national levels. So we've got national fellowships. And today I'm going to talk about three things. I'm going to talk about cardiac. I'm going to talk about thoracic, and I'll also try and talk about intensive care or, a medical fellowship as well. So everything that I say applies to all types of fellowships. So, and most of my talk is going to be based more on international fellowships rather than national fellowships, because that's the one where you really need help with. Okay. So national and international fellowships, that's what's available to us. The most important question, as we discussed when we were writing about the CV, and we discussed about the CV, the most important question that you have to ask yourself is why? Why do I want to do an international fellowship? Your why has to be very, very clear, because success comes only to people who know what is the reason why they want to do something. The how is actually very easy. Almost everybody can figure out the how if the why is strong. If the why is not strong, then the how becomes almost impossible. So don't worry about the how, concentrate on the why. So now I'll give you some reasons why people speak to me about doing international fellowships. And one or more than one of these reasons will apply to you. Again, my suggestion to all of you is to sit down with a book and some page of paper or whatever you like. Don't write with a pencil, write with a pen, and please try to pick up the points that are specific to your life. So this, because I'm addressing a group of 15, 20 people, the why may be different for another person, but it is very, very, very important for you to identify your own why. So the first why, which I think people look for when they're looking for fellowships, is because they want to learn a specific technique. So it could be mitral valve repair. It could be video-assisted thoracoscopic surgery. It could be uniportal VATS. It could be robotic. I don't know what it is, but you have to have a why. So that's the first one. The second why is people are looking to improve their skills. So they want more hands-on experience. They want more hands-on exposure at centers of high volume. So they want to go to a center where they will get hands-on experience and will be able to improve their patient skills and their operating skills. So that's the other one. Very, very often, the background reason why you want to do a fellowship is because you want to improve your CV, because your CV is looking quite drab. And the chance of getting a consultant job in a corporate hospital may not be good enough until and unless you have an international fellowship or something attached to your degrees or attached to your name. And so a lot of people are looking to get a good attachment in a corporate hospital. And that could be the reason that they're looking for a fellowship. Now, I want to clarify very clearly that any or all of these whys are all allowed. There is no such thing as a wrong why. Okay? I don't care what your reason is. The important thing is you've got to be honest enough with yourself to tell yourself, this is the reason why I want to do a fellowship. That is the starting point of any discussion. So you cannot make your CV for a fellowship until and unless you know clearly why do I want to do a fellowship in this particular specialty that I'm talking about. Some other why could be to travel abroad. A lot of people have never been abroad and they see the fellowship as a reason which will allow them to travel abroad. And maybe if it's a paid fellowship, it will pay for their stay abroad. And that's good enough. Some people want to make some money. So they think that working overseas, I will probably get a better deal. I'll probably make some more money, and I might be able to save some money to bring it back to India, where I will start my personal practice. And that is absolutely fine. Some people want to get a break into an overseas country. Okay, so some people want to actually emigrate to abroad, and they want to start in the system, because it's very, very difficult to get a break into an overseas country straight away. And fellowship might be one of the ways you can actually start your immigration process. So some people actually want to leave our country and they want to go abroad for economic reasons. And that's absolutely fine. There is nothing wrong with making a decision like that. Only thing is, you have got to be honest with yourself and to tell yourself, this is why I am applying for this fellowship. Because until and unless you tell yourself, there is no way you will be able to, do any more progress on the fellowship application. So what are the benefits of fellowship? Why should, when you go abroad, what happens? What is the benefit to you? Well, the first and foremost benefit, which I think is very, very, very important for all young people, is you get exposed to an international system of medical management, which may be completely different from what you have trained in the Indian environment. And that is really, really important. An exposure to a new system of managing patients is very, very important. It does open the windows to your brains, and you learn to interact with people from other countries, from other cultures. You learn bedside manners, you learn patient confidentiality, you learn about data confidentiality. So a lot of that exposure is important for you to be able to practice as a good surgeon in your own country. So it's very, very important. That exposure part of that thing is really important when you go abroad to do a fellowship. Of course, some fellowships are fully paid fellowships, and I'll talk about that in a minute. So some people, you can save some money and bring it back, because at the end of the day, the value of a pound or a value of a dollar is higher than the Indian currency. And a lot of us, when we go abroad, we spend very thriftily. So we make sure that we don't overspend, and we save some money. And that might be of use to your family or to your children. And as I said, it opens the doors of your brains, the windows of your brains. You really understand that the world is becoming a smaller place now, and you learn to interact with international doctors, with international patients. And that will directly affect your practice when you come back to your country. I really believe that when you go abroad, the most important thing that you learn is to practice evidence-based medicine. My personal impression of the practice in India is that if a patient goes to a certain specialty, he is going to do his thing. So if it's a lung cancer guy who ends up with an oncologist, rest assured the patient will get chemotherapy, whether it's a stage 1, stage 2, or stage 3. And if he unfortunately goes to a surgeon at stage 3B, rest assured he will get a surgery. So there is no concept of this evidence-based practice where, let us downstage him with chemotherapy, then restage him and then operate. So when you go abroad on a fellowship, you definitely learn how to use evidence-based medicine, and you learn about all international guidelines. And of course, the most important thing is it's an opportunity to travel. You get to see a new country. While you're working on a weekend, you'll be free. So you might get to see a new country. Divyesh, did you raise your hand? Is there something you want to ask? Okay, just hold all your questions till the end. All right? Okay. Now, when you are applying for fellowships, for international fellowships, there are various durations that people apply for. And a lot of people ask me, how long do you think I need to do a fellowship before I can become proficient? And it's very difficult for me to answer that question, because the duration that is needed depends on depends upon your own level of efficiency. It depends on how good you are at something and how little time or how little exposure you need to become an expert on that field. So your duration for a fellowship could be just a few weeks. For somebody like me, if I want to learn uniportal VADs, or if I want to learn an anterior approach to VADs, I will need to go only for 1 or 2 days to a specialist center to observe what they're doing, and I can come back and implement that practice in my clinical practice. But for some people like you who are still very young and still learning the trade, you will not be trained in a few weeks. You actually need more, and you will probably need more hands-on experience. A lot of fellowships do these for 3 months, and these are usually fellowships which are run through societies, or these are fellowships which are run through international bodies, where the duration of the fellowship will be 3 to 6 months. Most of these are paid for by either the society or the international body like the UN or the WHO, and the hospital will not bear the cost for a fellowship like this. And the standard international hospital-based fellowship is usually 1 year. So that is usually the duration that most hospitals are looking at, because if they're going to fund you and they're going to pay you a certain amount of money, they don't want you to leave within a few weeks, because it will still take you a few weeks to get used to the hospital and the systems and all that. So they want to get their money's worth out of you. So they will usually insist on at least a 1 year fellowship. And sometimes if it is a real super specialty, the hospital will insist on a minimum 2 years fellowship. And I'll talk about various countries in a minute, and I'll try and explain to you which country demands what. But the duration of the fellowship is entirely decided by your level of experience. So if you are not at a certain level of experience, then you probably need a longer duration. If you're at a very high level of experience, you just need 1 or 2 days, nothing more than that. So it completely depends on you, not on the body which is offering you the fellowship. There are two differences between fellowship. One is a fellowship and one is an observership. The observership usually is for a very short period. So the one that I was talking about, 1 or 2 days to see a anterior approach of VATS, that's an observership. Usually it's a mid-career move for most people. So people who are already proficient in their jobs are getting on with things, and they just want to learn a new technique or observe a new technique. They'll go for a few weeks, they'll go for a few days, and they will do that. So you, in that situation, you are only allowed to observe. You cannot touch the patient. The medical legal side of things is usually very clear that you cannot touch the patient. You can have no interaction with the patient. In fact, even talking to the patient is not allowed. You cannot have any personal interaction with the patient. You are directly attached to the individual or individual surgeon or to the hospital, and all you do is stand in the background and you observe things as they are being done. And usually this sort of an attachment does not need medical licensing. And this is the easiest one to arrange for us. I mean, and the reason why I'm discussing with you is because I sit on the other side of the table. So if somebody asks me for an observership, that is usually the easiest one. And I can just say yes, because all I have to do is get an agreement with one manager somewhere in the hospital, and that's it. I don't need to go to the medical council. I don't need to go to the HR or anything like that. So observerships are the easiest ones, but of course you cannot scrub in and you cannot touch the patient. That is mandatory in an observership. Let's come back to fellowships. Fellowships are usually for longer period. Most of the international fellowships that I am aware of are 6 months and above. 6 months, 1 year, or 2 years. These are the three durations that we offer to you guys. These are usually designed for early surgeons, as in you have either you're in a final year of your training, or you are just qualified, or you are in the first 5 years of your training, of your career as a surgeon. So these fellowships are usually for early surgeons, and I think most of you probably fit into that group of being an early career move. In this situation, you can see the patient, you can examine the patient, and you can operate, but under supervision. You cannot operate independently. So usually we have to get you a medical licensing to be able to do this. So this is very important for us to understand what is your requirement. Do you need to come in as an observer, or do you need to come in as a fellow? Because as a fellow, we can actually expect back from you. We can expect that you will contribute to our program, to the surgical care of our patient, which includes pre-op, includes intra-op, includes ICU, includes on-call. So we will expect a fellow to be part of the whole protocol, not 9 to 5. You will be expected to do even the on-calls for our department, and that is mandatory. What is the hospital's approach to an observer? An hospital doesn't care. If an observer is there, they are not bothered because they have no commitment to the patient. It's just the individual consultant who will teach a little bit, and there are no legal issues associated with it because you're not licensed, and they prefer you to be unseen. They don't want you to be in the scenario trying to do this or trying to suggest this. Just come in, sit quietly at the back, and go away when you are finished. Take your certificate from us. And most of the times these certificates are signed by individual consultants rather than the hospital body. So an observer is the easiest for the hospital. They don't care. They have no commitment to you. So you go to that individual surgeon or that individual physician and you learn certain techniques from him. And that's all that they want to do. However, the hospital's approach to a fellow is completely opposite, because they want you to perform clinical activities in their department. So they need to make sure that you're an efficient doctor, which means that you are trained up to a certain level. So if you're going to a transplant fellowship, a cardiac transplant fellowship, and if you don't know how to put a patient on bypass, you are a liability. So they will not pick you up for a fellowship. They need people who are able to operate at least basic stuff independently. They need people who are team players. This is very important. When we pick up people for fellowship, the most important thing I want is what is the attitude of this person? Is he, somebody who gets along with everybody? Is he somebody who is jolly? Is he somebody who's willing to learn? These are important attributes, and we actually do look into your background. Nowadays, the hospitals are also doing social media search. So not just your references, which are very, very important, your social media search is also done by the hospital to find out what sort of a guy are you. You don't have a drinking problem. You're not somebody who's a drug addict and things like that. We really want to make sure that you're a team player. That is the key thing for almost all of us. You have to be language proficient. So if you're going to England or you're going to the US or Australia, Toronto, English is mandatory. If you're going to go to one of the European countries, then they expect you to be able to communicate in the local language if you're going as a fellow. So if it's Germany that is offering you a 1-year fellowship, they will expect you to be able to speak basic German. If it's Korea that you're going for a 1-year fellowship, they will expect you to be able to speak at least basic Korean. Or you have to show in your CV that you have attempted to learn the language. It's quite important. A lot of you people don't realize this. You just think you're applying for ASCVTS fellowship and what the hell, I don't need to know the language. But in Korea, if you go there, a lot of people don't speak English. And so it's very, very important that you are language proficient to the hospital that you're applying. And most of the hospitals want an experienced fellow. So most of these fellowships are at senior registrar and above, a senior resident and above. not quite a consultant. So senior resident, associate consultant, or an assistant consultant. If these are the three categories, you are more likely to be picked up for a fellowship. If you are in your first year training, we will not pick you up because we don't want to spend the time to teach you how to put in an intercostal drain. If you're coming to learn robotics from me, I don't want to teach you how to put in an ICD. So it's quite clear about that. So we need a certain level of experience before we will appoint you to this job. In a lot of hospitals, particularly in the US, the fellows run the show, which means most of the operating list is actually done by the fellows, the cardiothoracic fellow or the thoracic surgical fellow. So if you don't know how to do a thoracotomy, or if you don't know how to do a basic VATS, bulectomy, pleurectomy, you are no good to the hospital. They will not be able to teach you advanced VATS lobectomy until and unless you know the 3 ports. Okay, so it's very important that you are up to a certain level. We as trainers, usually for a fellowship, we prefer people who have some level of independence, which means, see, there are 3 types of surgeries that you do. There is minor, intermediate, and major. So I want you to be at least minor and intermediate efficient before you come to me for a fellowship for a major procedure. So if it's an advanced VATS fellowship, you should be able to do a basic, VATS pleural procedures. You should be able to do a VATS mediastinal tumor. If you're going for an aortic fellowship, you should know how to do an aortic valve replacement, a basic aortic valve replacement. If you're going for mitral valve repair, you should know how to put a patient on bypass, how to do a mitral valve replacement. So you cannot learn to do a repair until and unless you know how to do a replacement. So we want them to be independent surgeons. The other thing that we want is you should be, the statutory and mandatory training should be on board, which means you should have done your ACLS, you should have done your ATLS, you should be basic life sciences certified. So basic cardiac, advanced cardiac, and ATLS certified, because you're going to be on call for us. And if you're going to be on call for us, and if a trauma comes, or there is a cardiac arrest on ward 4B, then you need to be able to run the show for managing the arrest. So we want you to do all the basic requirements, at least before we take you on. And of course, when we have somebody like that, there is a huge financial implication for the hospital, because the hospital will pay you a full salary. So it's not as if we are going to make you work for free. We will actually pay you a full salary. And so that is equivalent to what any other doctor in the UK or the US will get. So it is an important commitment that we want from you. And that is why the period is always 6 months to 1 year and above, never shorter. Okay? Now let's look at the financial implications to the hospital. So we have various types of fellowship available. So we have various types of, the first one that we have, which I offer in the UK. Yes, I'm ready. Please shut your phone, please. Yeah. So the first type of fellowship which I offer is a hospital paid, fully paid salary, which is on par with national standards. So we cannot say that you have come from India, let me pay you only £1,000. That is not allowed. And the other thing is, because you're fully paid, you are governed by the European guidelines of working time directive. So we cannot make you work like a donkey. 40 hours is 40 hours. 48 hours is 48 hours. So that is the best fellowship that you can get, which is a fully paid, on par with national standards, both in terms of working standards and in terms of financial remuneration. And that is the fellowship that you should try and hook up if you can. The second fellowship usually that you have is a fixed amount fellowship. These are usually 2 types. One is it's either a society paid fellowship or it's an industry paid fellowship. And in this type of fellowship, you have a fixed amount stipend per year, per month. You do not have a salary, you have a stipend. And the stipend will usually be just about enough to cover either your travel cost or your local stay. For example, the ASCVTS fellowship for thoracic surgery actually gives you £1,000 a month, $1,000 a month. Now, $1,000 a month in Korea, in Seoul, which is one of the most expensive cities, it was number 3 on the most expensive cities in the world last week, does not go far. So $1,000 a month will probably just about pay for your stay in a small single room apartment, and maybe pay for your travel and a little bit of your food. Okay, so that is a society fellowship which does not pay you as well, but the experience is invaluable. So if you are only looking for experience, then a society fellowship is a good one to look at. There are some fellowships where we only pay the traveling cost. We will not pay you for a stipend, we will not pay you for you to live, and we will not pay you for anything else except a traveling cost. These are called as traveling fellowships. And these are they might be easy to get, but pretty difficult to survive on, because you've obviously got families and things like that to think of. And the last one is, of course, unpaid fellowships. If I was you, I would never take a long-term unpaid fellowship, because if somebody doesn't value your skills and is making you work for 40 hours a week and not paying you, then that is not worth it. The only reason why you will take an unpaid fellowship is if they promise you that, one, they will give you on-calls, which means you get paid for the extra on-calls that you do, which is also called as moonlighting in the US. Or number 2, they promise you that you come on an unpaid fellowship and within a few months, we will give you a job. That sort of a fellowship is worth looking at. Otherwise, do not look at the unpaid fellowships, okay? And those are usually short term, 1 month, 2 months, 3 months. So it's quite important to understand what is happening. The fully paid, as I said, covers everything. It's a salary. The fixed amount usually just covers for living expense, and the traveling fellowship just covers for travel, and unpaid doesn't cover anything at all. Everything is at your expense. So you got to think very carefully before you venture on this one, okay? So the various fellowships out there at this moment, which I have researched and I know about. So first one is the society fellowships, okay? And I'll tell you about the various societies in a minute. And I'll tell you both about cardiac and thoracic, so don't worry about that. Then there are hospital fellowships, like my hospital, St. Bartholomew's, offers 2 fellowships, which are run not by any society. It is actually run by our hospital. And the first fellowship is called as Robotic Thoracic Surgery Fellowship. And the second fellowship is called as Advanced VATS Fellowship. In fact, we are also starting a third fellowship, which will be Interventional Bronchoscopy Fellowship, which is a EBUS and EMN based fellowship. But because our hospital is paying you, we definitely expect you to do the routine work. So you cannot say that I will not do a routine theater because I'm a robotic fellow. That's not acceptable. You get your 1 or 2 days slot in the robotic theater, but we will expect you to do the regular ward rounds. We'll expect you to help another consultant with his list. We will expect you to do the clinics, and we'll expect you to do the on-call. For this, we pay you a complete salary. So we're talking about £5,000, £6,000, £7,000 salary. So, that is probably the best one to get, but the most difficult to get, all right? Then there are individual surgeons fellowships. So something like many years ago, I offered in Medanta a fellowship under my name. So it was my program. I was going to train the surgeon for VATS. So I had a fellow come from Malaysia. The Malaysian government paid everything to the fellow. They paid him a salary, and he came to me, and I took responsibility for his training. So there are a few of these available around, and we can discuss according to individual cases if this is what you're interested in. Then there are specialty fellowships. Like I told you, robotic surgery or so these are disease specific. These are like a heart failure fellowship or a ECMO fellowship. So these are disease specific fellowships which actually will help. And the last one is of course industry fellowship. I think in India, Tata has this Ethicon fellowship, which is probably paid by Ethicon Johnson and Johnson. So that's a different type of fellowship. It's always a very small period of time and always a limited amount of remuneration that you get out. What are the countries that you must target? I really believe that these are the countries which are the best for you. One is UK. UK because UK has, you speak English. So you guys are very, very fluent with this thing. The other thing is the UK has an NHS system. So these are not private patients. These are national health service systems. The only problem is in UK, you have to actually be able to break into the system and break through the GMC and the visa rules. And I'll talk about that in a minute. Within Europe, there are a lot of fellowships being offered. There are fellowships in Germany. I know of fellowships in France. I know of fellowships in Switzerland. I know of fellowships in the Scandinavian countries. So, Norway and Sweden and Denmark. The only problem with these fellowships is you need to be able to speak that language. I definitely know there's a laser fellowship offered in Germany. Again, the problem is you need to be able to speak the language. That is the biggest difficulty that you have. I think Australia is a great country to look at for fellowships because they do have vacancies. Their health system is a national health system. They do promote overseas people to pass their exam and come and take up a fellowship. And the best thing about Australia and UK is that if you know how to play the game right, and if you get through the system, you might even end up with permanent residence, or you might end up with citizenship. Okay? So these two are very important to know, that UK and Australia may actually purely through a fellowship be able to get through into a citizenship program. So it is possible. It is a first step into the system. So that is something that you have to keep in mind when you're deciding. The US is a very, very good place for going for fellowships. But now with the new administration in place, they are making visas more and more difficult. So the problem with the US is that the fellowships are great. The funding may or may not be available for all fellowships. But most importantly, they are making the visa into very, very difficult process. So it's very difficult to get the visa. And I personally think Canada has, again, a very good system of fellowships. 2 or 3 hospitals offer some excellent fellowships. Toronto General is a prime example where you can go spend 1 or 2 years in lung transplant. You can learn the technique and come back. Canada also has very friendly immigration laws. So it is possible that if you do your fellowship, you can sidetrack into the system and maybe end up into the immigration and the citizenship pathway. So there is possibility to do that. So UK, Australia, Canada probably are the ones where you can sneak into the immigration system, provided you prove that you're good. That's the important thing. So if they need you, they will make sure all rules are overlooked. If they don't need you, there will be 200 rules to face. And currently in the UK, with the Brexit coming in, we are losing a lot of European doctors. They are going away. So we are going to have huge vacancies, and we definitely need manpower. And fellowships would be the first point where we would get people in. So it's quite important to remember this. So where to look for fellowships? Who tells you about fellowships? What is available? Besides doing a lecture like this, I don't think anybody anywhere in the world would sit on a computer and try to advise you on how to do fellowships. The most important thing is word of mouth. You must keep in touch with your other friends in the specialty, with your mentors and your teachers in the specialty, and you must go for meetings. If you don't go for meetings, if you don't go for conferences, nobody's going to come and whisper into your ears that there's a fellowship available at Bart's. Okay? So word of mouth is probably the most efficient way of getting an early bird entry into a fellowship program, because each fellowship is highly competitive. And more the people know about it, more people will apply, less is the chance of you getting it. Social media is quite good these days. A lot of fellowships are actually discussed on social media, and WhatsApp groups and things like that might actually give you an insight. Hospital social medias also put out their requirements for fellows very often. The society website is a very, very good point to look for fellowships. The only problem is by the time it gets advertised on the society media website, a lot of people have heard about it. And so the number of applications dramatically goes up when there is a official advertisement for a fellowship. I would suggest that if you are interested in a particular specialty, for example, lung transplant, or for example, aortic valve, aortic root surgery, then find out the big hospitals that do these surgeries and enlist on their monthly newsletter. So every month they will send you a newsletter talking about the new things that their department is doing. And very often at the end of that newsletter, you will find we have now got funding to appoint a fellow in intervention or a fellow in transplant. And that is a good point for you to know that the fellowship is coming up, because not everybody knows about these newsletters. So it's a good point for you to go be ahead of the game, and you have to subscribe to the newsletters for all the important hospitals that you are wishing to train in. In the UK, most of us actually look for these jobs on BMJ Classified or nhsjobs.co.uk. You just need to Google it, and every week, the point at which all these jobs get advertised is the Friday morning. Thursday evening, you must look at NHS Jobs website. All jobs get advertised on a Friday, and usually the closing date for application is usually 2 Fridays or 3 Fridays down the road. So Friday is a good day, at least when we were training and we were looking for jobs. Every Thursday evening, we never went out. The Thursday evening was spent looking through the BMJ Classified and the NHS Jobs website. Again, I would advise you to subscribe to these two websites. They actually match your job. So you're asked to put a tick box on what is your specialty, what is the level of the job that you're looking at. And as soon as somebody advertises the job, you will get an email saying this job has now been appeared in the BMJ, or it has now appeared on NHS Jobs website. And so that will give you an early indication of the job. But most of these jobs usually have a deadline before which you have to apply, because that's the law. It's by law that we have to do that. And one other good website is the Royal College websites. So Royal College of Australia and New Zealand, or Royal College of Canada, Royal College of UK. So these college websites sometimes actually advertise these jobs. Also, a good website to look at, particularly if you're interested in the US, is at CTS.net. CTS.net has a special section to look for students and residents, and they have a special sections for job advertisements. And so even before it goes through the national programs, these hospitals individually can actually advertise on CTS.net. So it's quite important to know where to look for these jobs. Okay. Is it making sense so far? Or is it getting boring? Is it making sense?
Yes, sir.
Yeah, I am trying to guide you and give you an insider's view from the other side of the table. Okay. All right. Now let's look at some of the hurdles that you face when you do fellowships, when you want to get into a fellowship program. There are 3 hurdles that you have to face, okay, when in a fellowship program. The first hurdle is at the hospital level, where they have to give you an appointment. The second hurdle is at the medical council registration. So it does not, if you've got a job, the medical council will automatically give you a registration. And the third hurdle that you have to that you have to face is the visa problem that you have to face when you are applying for fellowship. Okay, so we'll go through each one of this in more detail so that you understand what is needed. Whose phone is on? Somebody switch off your phone, please. Okay, all right. So let us see what are the hurdles at your end. Okay, before we talk about the other end, let's see what are the hurdles at your end. The commonest hurdle at your end is your current job. Your current job can become a big hurdle when you're trying to go for fellowships because you may or may not get sabbatical leave. And particularly when you're talking about a 1 year fellowship, nobody is going to keep the job for you for 1 year. Very, very rarely in some hospitals, they will actually keep the job for you for 1 year. Most of the times, you have to resign from the job. And not only you have to resign, but you have to give a period of notice. And sometimes the start date of a fellowship, you might just be lucky that somebody was supposed to take up a fellowship and he didn't take up the fellowship. And they might approach you at a very short notice and say, you're the next guy on the waiting list. Do you want to come for this fellowship? And you may not be able to do it because your hospital is not leaving you. And so this is a real problem which I have faced with a few candidates internationally. Where I offered them the fellowship, but they could not come because the hospital would not give them leave or the university would not give them leave. The other important thing is financial preparation, because this is a real big commitment that you're making. You're going to leave your family or take your family with you. So you really need to have some backup money. Almost all of you who are thinking of doing fellowships, make sure you have financial stability in the bank, because it is not a cheap process. Even though it might be a fully paid fellowship, it is still not a cheap process. And I'll talk about that in a minute. I'll tell you exactly what are the expenses that are involved when you're trying to do fellowships. And of course, the other big hurdle is the family preparation. Wife, children, parents, they may not want you to go. And these are real issues that you must solve even before you start applying for fellowship. Don't think that you will be able to solve these problems once you've had a job offer. It never happens. It never happens. So if you are deciding that in 2021, I want to do a fellowship, you better make your family aware that this is my plan, this is how I'm going to do, this is the backup plan, this is how we will sort the money problems, this is how we will sort the relationship problems. So all of this has to be looked into it before you can join into a fellowship program. Trust me, all these advice that I'm giving you are because I have really seen these things happen. I have seen families fall apart. I have seen marriages fall apart because the spouse went away for a 1 year fellowship because he suddenly dropped it on the wife. So it's very important that you plan this from start. You have to tell your spouse from start, and she has to be on your side. Okay, it's very, very, very important. The family side of things is what actually holds most people back. I personally think that the spouse is the most important decision maker in your decision to do a fellowship. If you're single, it doesn't matter. Parents are usually very supportive. But when it's a spouse, you got to remember she's got her own job. She's got her own priorities. You know, it's a huge disruption for her. And when you have children, it's even worse because the children have to, be readjusted in schools. They're already in schools. So this is very often people actually are unable to do a fellowship because of this factor. So my suggestion to all of you, whether you're unmarried and planning to get married, or if you're already married, or if you've got children, all three groups must talk to your respective partners, either your parents or your spouse or your girlfriends. It is mandatory. You'll be surprised the number of times people have a fully paid fellowship. In fact, last month, I offered a job to a guy from Egypt. Okay, a fellowship in VATS, 1 year fully paid fellowship in VATS. We send the paper for him to get his visas and everything. And then he comes back and says, my wife is not willing for me to go. And then suddenly we are in a mess and, the whole system gets thrown for a toss. So it is important that you sort this one out before you start applying for fellowships. Okay. Now, some insights for you about fellowships. I'll just tell you, the most important person in the whole game, I promise you not, the most important person in the whole game is your referee. There is absolutely no doubt in my mind about that. Before I take on anybody into my unit or my department, I will look at your background and I will look at your reference. I really will phone up your referee and I will call him. That's why I said in the CV, when I spoke yesterday, I told you in a CV, we want a very good and very clear email, just a single email, and we want a very clear phone number where we can reach the referee directly. It is absolutely mandatory. And the other thing we understand as people on the other side of the table is that a good reference does not mean that you're a good candidate. I said this yesterday as well. A referee will give you a good reference, A, if you're a very good candidate, or B, if he wants to get rid of you. Because you are causing him problems in the department, you're having fights with your colleagues, you're not getting along with the department. The best thing for him is you go to another hospital. And the best thing is offload your problem to some other department. And we, as people who are experienced in these things, we can see through a good reference where somebody is trying to offload a person. So it's very, very, very important. Your referee is the most important person. Do not put the name of a referee who will not give you a good reference. And do not put a name of a referee until and unless you've spoken to him. You have to have assurance from him that he will give you a good reference. Only then you put in the name. It's very important to choose a correct referee. You will be surprised the number of times where I have offered the job and then canceled the offer because the references were not up to the mark. Really, I have cancelled the offer because somebody gave me a bad reference on the quiet. And most of the times, the bad reference on the quiets come on a phone call. They tell us that this is a problem, don't take this person. So you'll be surprised how often that goes away. So be very careful when you're working, wherever you're working. Develop good relationships. Make sure you're in with your teacher. Make sure his reference is going to be good for you. In a society, most of the times the appointment is by application. So when it is a society fellowship, then one person cannot decide. He has to sit in the executive board and everybody looks at it. And then we decide who is the most deserving candidate to get this fellowship. There are some international fellowships which are offered by WHO and the United Nations, and you must look at their websites. These are fully paid for. The one thing I forgot to put here is Commonwealth. Don't forget Commonwealth. So Commonwealth, WHO and UN actually are providing fellowships in areas of interest. So if you're a cancer surgeon, for them that is an area of interest. If you're a tuberculosis surgeon, for the WHO it's an area of interest. If you are a heart failure surgeon, then for the Commonwealth, it's an area of interest. If you are an ECMO fellow, that is an area of interest. But those bodies want to develop these services in the third world. So they will offer out these fellowships. So don't miss out on these ones. And these are usually the best ones because they pay for everything. And then sometimes you have in-service agreements. So check what is the arrangement of your referee or your hospital with an international organization. Like I have an arrangement to have an international exchange program. So my guy goes to that country, that guy comes to my country. And so that in-service agreement actually works very well for both of us. And most of the time, we will make sure that references are good for the candidates. We will not send a bad candidate on an in-service agreement because they will send us a bad candidate. It upsets the rhythm of the hospital. So we always try to send good candidates. Okay. I cannot stress enough. I cannot stress this enough. If you really believe that you have made, a lot of you are making applications after applications after application. And the problem is you're not even getting a reply to your application. That is the problem. What I want you to understand is 95% of the times when we are offering a fellowship, the fellowship is decided before even advertising for the fellowship. And most of the times it's a referee to a referee, it's a mentor to a mentor application. And most of the time it happens at dinners at national or international conferences. I go for hundreds of conferences, and I cannot remember even a single conference where at dinner time I did not agree to exchange candidates from this country to that country or that country. Most of us want to do that. And remember, out of sight, out of mind. It's very simple. If you are not at that dinner, and when somebody has made request to me that, listen, I have had this job come up in so-and-so institution, the first guy, if you're sitting there in front of me, you are going to be in my mind, and I will make sure that I recommend you. So it's very, very, very important to be with your mentor at important dinner, at important national conferences and international conferences. I'm telling you, this is the most important thing. You should be throughout the day, you must sit next to your mentor in the conference. You should not leave his side, because every time he gets up to meet somebody, he will always introduce you to the person next to him. So it is very important you tell your mentor that, listen, I want to do a fellowship in Seoul National University, or I want to do a fellowship in Taiwan National Hospital. Then when you are with me in an international conference, I will make sure I introduce you to the correct guy on the opposite side. And then you take it on from there. So please understand that fellowships are usually, unless it's a society fellowship, most fellowships are pre-decided. So it's very important to have a good referee and a good reference from people. And you should make sure you're physically present at that conference. If you went to the conference and went out sightseeing in Srinagar, then that's no good. I'll tell you, there were so many times when I was in Srinagar doing a conference, and most of the people who came from other places, they went out sightseeing to Pahalgam and Gulmarg and all that. And the senior guy was sitting in the room listening to the talks. But the one guy who stayed next to me actually got appointed to a fellowship in Australia. So it's very, very, very important to realize this, okay? I cannot stress this enough. You have to be seen on the stage with papers. Doesn't matter what is your quality of paper, but you must have a paper on stage. And if you know that there is a transplant surgeon coming to that conference, then for God's sake, try to be in the paper, try to put in a paper into that session, and hope that you can stand up in front of that transplant surgeon and present your work. Because whenever I am sitting in the auditorium, my only aim, besides trying to learn science, my only aim is to pick up my next guy, or to pick up who do I want to recommend for the next fellowship. I promise you not, this is the only aim. And if somebody impresses me from the stage, I will take the effort to find out who the guy is and make sure that we take care of it, okay? So it is very, very important for you to have a direct one-to-one meeting with a mentor. I don't care who your mentor is, but make sure he's a guy who will pick up the phone and call for you. That is the key ability you need in a mentor. So very, very, very important to be in touch with the seniors in your specialty. They are the ones who will get you the job. And then, of course, your CV is important. So those things we spoke about yesterday, I spoke in great detail about the CV, and I'm assuming that has helped you. Some advice for you regarding fellowships. Decide your specialty. I'm not talking about cardiothoracic. I am not talking about thoracic. I'm not talking about cardiac. I am talking about super specialty. Decide, I want to do robotic. I want to do aortic surgery. I want to do dissection surgery. I want to do mitral valve repair, ECMO. Decide your specialty. Very, very, very crucial. Because the moment you have decided your specialty, then you zoom in onto a handful of positions across the world, and then you can guide your mentor to help you into that specialty. More specific you become, the better for you. If it's just a general thoracic fellowship, is no good. Nobody's interested in a general thoracic fellow because my own country has got hundreds of them. I don't need you. But if you want to learn a very dedicated part of my specialty, please come here. The why has to be very clear. Why do you want to do? Why do you want to do transplant? If you tell me that I want to do transplant because I want to come back into this country and I want to set up a lung transplant unit in the north of India because there is no lung transplant unit in the north of India, fantastic. Why? I will go out of my way to promote you. But if you tell me that I want to do a transplant fellowship because I'm looking to stay back in Canada, then I may be a bit hesitant to help you. I mean, I'll help you in other ways, but you're a waste for a transplant fellowship. You understand that? So the why has to be very clear. It's very, very, very important. And more important for me is not what you do before the fellowship. What will you do after the fellowship? When you have finished it, I want a clear pathway. You have to tell me that, I want to do this in this hospital, set up this. And it has to be not just weird goals, weird dreams. It has to be time specific. So I will go 2001 September to October 2021 to 2022. Then when I come back, I will already have my medical legal requirements. We would have got the certification. By March 2023, I would have started my transplant program on this day. The first case would be scheduled hopefully for 1st of March. That is the dedication I want. That is the clarity I want. That is when I will go out of my way to push you towards a fellowship. Okay, so very, very, very important. So like I said in the CV, it's very important what you bring to the table. What are your qualities which make you specific to this fellowship? What have you done in the past which actually add up to the journey to this fellowship? And also you have to match up what the hospital needs from you. So this CV plays a very big role in this. You have to match up things to what the hospital says and what you can bring. So yesterday I told you clearly, there are two factors, essential criteria and desirable criteria. And if out of 15, 20 people who are in the room, if 14 of you have not gone back and Googled what is desirable criteria in a job and what is essential criteria in a job, then I promise you, you will never do it. Because to change your CV, you need to know what is the essential criteria and what is the desirable criteria. And over the next 1 year, you have to actually work towards making sure every single desirable criteria is fulfilled. Okay? Absolutely clear. Your CV must have a vision statement and a mission statement. I said this yesterday. You must have a clear vision and a clear mission where you are going. Okay? It's quite important. Okay. Meet the mentor. Do not hide from the mentor. Choose your mentor. Get time out and meet the mentor and talk about your requirements. Get referral to a specific surgeon or a physician. So don't think your mentor will know who to send you to. You have to come and tell me, listen, I want to go and work with Magdi Yaqub. I'm talking about old days. Magdi is retired now. But if you come and tell me that, then I will find the pathway to work with Magdi Yaqub. If you come and tell me, yeah, can you get me a job somewhere? I'm not interested. I don't have time for that. You tell me who you want me to get in touch with, and I will try and do that. And most important, I said that again, essential criteria and desirable criteria. It's very important. You have to do this. I can't do it for you. You have to do this. Okay? Remember, the dates are always in future. All important fellowships are heavily booked. So do not apply if you are not ready. Please apply when you are ready. Plan beforehand. Make sure you've got your leave in place. You've got applications in place. everything is heavily booked. Don't forget about deadlines. In Canada, if you wanted to apply for a transplant surgeon's fellowship, the last date was 28th of February this year for 2022. Now, if you didn't apply now, there is no hope that they will even entertain your application. The official deadline was 28th of February 2019. So you have to know this. If you don't know it, you will miss the boat. By the time you wake up, it's too late. Apply to many places. Don't apply just to one. Apply to many places, because chances are you may not get picked up in a few, but one may work, and you should have a backup plan. If one doesn't work, what should I do in another place? Very, very, very important. Okay. Now, something I want to talk about mentors and program directors. Okay. I find this really, it's from a personal experience and from discussing with all my colleagues across the board. You know, we are here to help you, but by the same token, we are extremely busy people. All of us are extremely busy people, and if you keep bothering me too much, I will lose interest in you. So don't bother your mentor. Write to the secretary. The secretary is there for a reason. Okay, the secretary is supposed to be your first point of contact. You write to the secretary, and if you cannot get through to the secretary, then you might put in a little note to the mentor. But don't directly try to, if the HR says that you need a certificate from your hospital, then don't call up your mentor and say, oh, please, can you help me with this certificate? He is not bothered. He doesn't have time. So for God's sake, try and reach out to your mentors through the secretaries, because that will put them in a good state of mind about you. If you keep bothering them too much, you will go back of the list, because he's got hundreds of people who are bothering him. You've got to prioritize. And most important is be polite to the secretary. You will be surprised the number of times I have rejected an application because the person did not speak politely to my secretary. When I come in, my secretary actually will tell me, sir, this guy is not good, because he really spoke rudely to me. I made an arrangement for him to meet you, and he was very rude about it and very rude about the timing. And immediately I will cancel that appointment. I will not see the person. So most of us, because we are so busy, we are heavily dependent on our secretaries. We are heavily dependent on our residents. And if any of them says a bad word about you, we will actually believe them. We won't even bother to clarify whether you're nice or not nice or a good candidate. I won't even see your CV. I will just go and say that's not bother. Somebody's phone is on. Who's this? Pillai, shut off your phone. Don't be too pushy. Please do not be too pushy. If somebody, you guys, you are young guys. Most of us are middle-aged people. We are not born in the internet era. We are not born in the social media era. So if you send me an email and within few days or within few things, you write back saying, what has happened? Why have you not replied? Or you write gentle reminder, that irritates me. Don't be too pushy. Just send your email. Give us time to think. Give us time to work over it. And then we will reply back to you eventually. If somebody is serious about you, he will reply back. By the same token, don't get too relaxed with your mentors. Okay, they are your seniors. Treat them like that. Behave with them with respect, and really just make sure that things are okay. Don't put one CV across and then forget about it. You have to follow up. You have to chase it up. So don't get too relaxed about your application. I know you need an answer, so contact the secretary. That is the best point of contact. Contact the secretary and they will help you. Now, as I said, do not expect immediate reply to your emails. This is a huge problem nowadays, where you guys live in an internet era. Each one of us gets at least 300 emails every day. I personally have to go through 300 emails every day, in addition to doing my operative work and my clinical work. And I have to, most of the times my secretary will actually prioritize for me. So it is very important that we do not push and ask for a reply within a few days. Okay? Phone calls. I really do not believe that phoning a busy surgeon is a good idea. Never, ever, ever. Because you don't know where he might be, what he is doing. Pillai, Sundar, Sudarshan Reddy Pillai. Switch off your phone or log off. Nirmal Kumar, please switch off your phone or log off. Okay, so most of us don't like to be called. It's very important. If you want to call us, please request a time, make a time, make an arrangement, make an appointment, and then make the call. That is okay, but don't just randomly call people because you have access to a phone. Social media is not the best point of contact with a senior surgeon. Trust me, it is not the best point of contact. Most program directors are oldies. Most of them. Very few are like me who are very active on social media. Most are oldies, and most important, do not contact them on weekends or public holidays. You will be surprised how many times it irritates the person and he just doesn't want you in front of him. So do not contact them on weekends or public holidays, because what is urgent for you may not be urgent for the program director. And I get one day in a month where I'm really free with my wife and my children. And the last thing I want is a phone call coming through asking me, what happened to my application. That is, rest assured, I will just throw it away. I will not waste any more time with you. So do not do that. It's just, these are some points which I'm sort of trying to highlight. These are mistakes which you guys make because you belong to a different era and different generation. And we belong to a different generation. But at this stage, we are the decision makers. So it's important that you respect us for that. There are some etiquettes on social media which you must follow when you are trying to apply for fellowship. Very, very, very important. Okay. Don't get personal with the other person. Do not get personal. Maintain a polite professional distance. Very important. You'll be surprised how many times people get personal and start talking personal things with the program director. Emojis are not helpful. They work very well with your friends and your girlfriends and your boyfriend. They don't work very well in a professional environment. So don't do that, and don't forward messages and jokes to to somebody whom you're trying to impress and trying to do work. Certainly no festival wishes, okay? Because 200 people wish happy Holi is not happy Holi. Out of those 200, 195 I don't even know. But they have sent me, they have overloaded my phone with happy Holi today. So that is not indicated. I celebrate Holi. I'm very happy. I celebrate it, but I don't want 195 unknown people sending me happy Holi because that loads up my phone. So don't do that. Now, HR requirements are quite specific. You have to follow them. Hepatitis, HIV, and chest x-ray should be done. My suggestion is do it before you start applying so that you know your status. You will be surprised how many people do an occupational health checkup after getting the fellowship and they are found to be hepatitis C positive. If you find it 2 months before, it is a complete disaster. Nobody will employ you if you've got hepatitis C positive. However, if you did it now and you were hepatitis C positive, you can take treatment. You can take 3 months, 6 months interferon, and by the time it comes up to the fellowship, you will turn out to be negative, hepatitis C negative. And internationally, nobody will actually stop you from doing a job if you have had hepatitis C in the past, as long as your current viral count is 0. So don't worry about getting a disease, but at least know about it. Don't know about it at the last moment. Internationally, in the UK and everywhere, nobody will take you in a job if you are hepatitis C viral positive. Hepatitis B is different, you will know, but C is the one which is a problem. Chest x-ray. Everybody get a chest x-ray done. If you've got a lesion on a chest x-ray, take a treatment. Whatever, 6 months therapy for ATT, we don't care. But if you do a chest x-ray just before your just before you are about to travel, or at the time that you're trying to do the visa, and you find a shadow on the chest x-ray, finish. The first thing they will ask you is, where's your previous chest x-ray? And if you don't have one done 6 months ago, which shows no change, finished. You will never get a visa. So it is very important to get a chest x-ray done now. So at least you have a baseline to tell them that 1 year or 2 years down the road, there is nothing there. And if they find something, at least we can treat it. So quite important to get occupational health clearance, particularly in most of the international countries. UK is very particular, US is very, very particular, Middle East is very particular. So nobody wants somebody who's got a TB. So they will be very, very careful. They will not allow you to do that. Make sure your passport is current. For God's sake, don't wake up 1 month before your application and find out that there's only 6 months left on your passport. I've had one application where the person was offered the job. We did all the paperwork. Took us almost 3 months to do the paperwork. And when he had to go for the visa, the requirement of the visa is that the passport should be valid for 6 months after the date of application. And he did not have it. It was not current. And so he lost the job because somebody else was ready. And so we offered the job to somebody else. Make sure your statutory and mandatory trainings are up to date. Now, statutory and mandatory trainings are things like ACLS, BCLS, basic cardiac life support, advanced cardiac life support, fire support, health and safety, lifting, manual lifting and handling. These are all, there is a whole list which your hospital will look into. They should all be up to date. Keep your training up to date, because if you suddenly get a offer and you don't have your statutory and mandatory training up to date, you might lose the job, okay? And it's a good idea. I personally suggest this to a few people, that if you're starting to look for fellowships in certain areas, why not take a holiday in that area? So if you're looking for something like UK, why not go to London on a visit? If you can afford it, of course, and if you got the time, go on a tourist visa, do a visit, and while you're there, do an informal visit of the hospital. The moment I have somebody who visits me informally, even before they have applied, I'll tell you his chances of getting shortlisted for the fellowship is very high. Very high, because he's already met me, he's introduced himself, he's shown an interest in my job, he's shown an interest in my hospital, and more importantly, he wants to know that the hospital matches his requirement. That is a very positive thing, and I will always put this guy ahead of a lot of others when I'm shortlisting for the job. So it is a good idea to do an informal visit on a tourist visa. Okay. Now, medical council. Is it okay with everybody? Is it getting to be too much? I'm quite happy to stop. Okay. Guys, somebody tell me.
It's all right, sir.
Sorry?
We continue, sir.
Shall we continue?
We should continue, sir.
Thanks, Vikas. Thanks. Some quite important things which I'm talking. Now, medical council is quite important on the medical council side, that your current medical council should be up to date. Because when it comes to apply to the medical council, very often you will find that your own medical council has lapsed. And then it takes you 3 months to get your own medical council up to date. Because you cannot apply to a new country until and unless you get a good standing certificate. So the good standing certificate is very, very, very important. In UK, you will not get a medical council registration until and unless your good standing certificate is up to date. And it has to be done immediately. So they will tell you, now apply for a good standing certificate. So it has, the validity is only 3 months of the good standing certificate. So don't apply 1 year ago. Okay, just when you know that you're about to get it and you start the process of your medical council application, that is when you should make application for a good standing certificate. Because the validity is only 3 months and we need a valid good standing certificate when you apply to the medical council. The medical council always needs a hospital appointment letter. It's very important. So a good standing certificate, a hospital appointment letter. You must do your IELTS proficiency. Okay. You will be surprised how many times people have done everything else except their IELTS. So you have to do your IELTS proficiency exam. And remember that IELTS is valid only for 2 years. So don't do it too soon, but don't do it too late. Because if you fail And there is a possibility you may fail, because don't think everybody's English is up to the BBC type of English. You may not understand what they're saying in the speaking and the writing format. So if you fail, you should at least have a chance to do it again. There is a cutoff of 7, I think, for medical. You have to have a good level of proficiency. And another important thing with the medical council wants is all your appraisals should be up to date. So you cannot backdate your appraisal. Make sure every year, every 6 months, you're getting an appraisal and save it in your personal portfolio. It is very important to have a PDP, personal development portfolio. So save your appraisals in your personal development portfolio. Okay. The other thing that you have to make sure is check that your primary qualification is recognized by that country. In between, I remember when MMC, Madras Medical College, had this thing, they changed their name, I think, to MGR University. Correct me if I'm wrong, but there was something like that. They changed their name from Madras Medical to MGR, something like that. Maybe I'm wrong, but one of those universities had that. And what happened is that the GMC did not have the new name. So quite a few people got the appointment letter, they got everything. But when they went to the GMC and it showed MGR, they said, but what is MGR? We don't have this university listed in our list. So it's very important that you make sure from now that your primary qualification is recognized in the country that you're applying. Your medical college also has to be listed in the list of recognized institutions by GMC. Particularly important for people who are doing their post-graduation or have done their post-graduation from private medical colleges. A lot of private medical colleges are not in the list of the GMC. So you will spend so much money, you'll do everything, and then when it comes to get the GMC, your hospital name is not in that list, you're in deep shit. So be aware that this is one of the problems that you face when you're applying for fellowships. All appraisals have to be up to date. I said that before. And some countries have their own requirements like MRCS, FRCS, PLAB or USMLE. And if this is a legal requirement, then you just have to do it. There is no other way out for it. Okay. Now, let's see about the visa. What are the problems at the visa level? So you need a hospital appointment letter. You need medical council registration. You need an attachment in your own country, which means that you have to prove to the visa officer that you are not going to run away or be an immigration risk. So you need to have property, bank balance, or family. Make sure this is there. If you don't have enough bank balance, my suggestion is start now and build up a bank balance, because you have to submit 6 months or 3 months of bank statements before you go. Make sure you start building that up. And if you've got property in your parents' names, try to get it transferred into your own name, because that will help you with the visa. That's quite important. So you have to prove to the immigration officer that you're not an immigration risk. And that's really important. Always make sure you fill your annual tax, okay, and have your ITRs, income tax returns for 3 years. This is mandatory. So make sure you have ITRs of some sort. Bank statements for about 6 months. Confirmation of leave from your employer always helps, because it means that you're going to actually come back to your job, and that actually helps you get the visa. That's quite important. And the most important thing is no criminal records or previous visa rejections. So don't apply for a visa until and unless you're sure you're going to get it. Even a random visa just for holiday, don't apply it until and unless you have all the documents. Because if you suppose forgot one document and they put rejected on your passport, that will show up in your history no matter where you go, because everything is computerized. So when you go to apply for a visa, even if it's a holiday visa, make sure all your documentations are perfect so that you do not have a previous visa rejection on your passport. And most important is no deportation from any country. And that is, of course, obvious. Financial implications, there are quite a few. There is the application cost. So, paperwork, this, that. Medical council cost in the UK, it's about close to £1,000, I think. 400 for processing, 200 for something else, and then 430 as the medical council fee. So there's almost £1,000 cost even before you have started the job. Visa application and visa fees are very expensive because India charges for visas for all other countries. The other countries charge the visa back. So in a UK visa, you might end up paying, a lakh or 2 lakh rupees. It's quite a problem there. So you have to be, ready for these things. What about the travel cost? You got to be ready for the travel cost, and you must preferably have a stay cost for at least a year before you even think about doing fellowships. Quite important. And when you are away, if it's an unpaid fellowship, you have to make sure your family support is there as well. So there's a lot of cost involved in starting the process of fellowship. And the reason I'm telling you this is because I've seen this happen. These are all real things. I'm not making up any of these costs. These are real costs that you have to factor into the whole thing. But the good news is, if you're in a paid fellowship like the UK, within the first month, all this you get paid off. My own experience, I had so much debt before I got into the system, but the first month, everything got paid off. Because you work overtime, you do locums, you do this, you do that, you can very quickly pay off all of this. So don't worry about the cost. This is just basic cost that you need before you start doing that. Now, these are the various fellowships that are available out there that I am aware of: mitral regurg, aortic, TAVI, cardiac intensive care fellowship, transplant, heart and lung is separate, heart failure fellowships. These are the thoracic ones that are available: robotic, advanced VATS, uniportal VATS. These are the ones that we offer. And at BARTS, we also offer interventional bronchoscopy for EMN and EBUS. Okay, so there are various durations for these things. These are the various societies that are offering the fellowships. So American AATS, ESTS, EACS, ASCVTS, ATEP. So whoever is with whatever society know about these fellowships, okay? The various institutions that I know specifically are offering are these institutions. So I forgot the name in Japan, and the one in Australia is in Sydney, but I couldn't remember the name when I put this down. If somebody's interested, get in touch with me. I'll give you the details. It'll come back to me. In the US, there are specific, this is for thoracic. So you have Roswell Park, which offers a fellowship. The MSKCC offers one. Seoul National University offers one. Shanghai Chest offers one. And in Japan, in Tokyo, we have one fellowship, I'm personally involved with all these fellowships. And we can help you with whatever else that you're listing. The opportunities are many because in the UK, Brexit is just about to happen. And a lot of Europeans are leaving the NHS, and we need doctors. So we will actually very actively encourage you guys into the system, and we might even bypass some of the rules to fast track you into the system. Canada is having a similar problem. Australia has got cardiac surgery opportunities. Pediatric cardiac surgery opportunities are all over the place. Australia, UK, US, there are not enough people in pediatric cardiac surgery. And New Zealand is also offering immigration opportunities, okay? In the US particularly, you have the Veterans Hospital, and with Veterans Hospital, you can be employed directly with the Veterans Hospital, and they can take you on a local licensing. So you don't even need to go through the whole USMLE. You just have to do part 1, part 2, and not the part 3, and they will employ you if they've got a vacancy there. And so you don't have to go through the residency program. They will help you to take up the job directly with the hospital. That's called as local licensing. And the US also has one special visa category, which is called inventors or special skills visa. So if there is something that you have invented, or which is new, or which is revolutionary, changing thing, then they will actually invite you into the country. And of course, the last is the investor's visa. So if you got enough money, then you can, of course, enter into the US anytime. Within India, we have got a few fellowships that we are talking about. For cardiac, we've got the catheter-based interventions. Vatikuti is doing a robotic surgery fellowship. There is a CABG fellowship. There's pediatric cardiac surgery and VATS fellowships with individual surgeons. And if you need any of these, please speak to me. I'll try and tell you about it. That's the bottom line. Don't forget, the CV is the most important one. Your referee, your mentor, and your CV. These are the 3 things that make up your application for fellowship. It is all about you. You are the product. You have to sell yourself. Make sure you fulfill the essential and the desirable criteria. And there is no reason why your career will not take off, and there is no reason why you won't get an international fellowship. Okay, thank you. I spoke too much, but I thought this is the only opportunity I'll get to address you guys. So I tried to talk about all the problems that you could face, but don't get discouraged by the problem, because every single person that I know who has expressed a desire to do a fellowship has done a fellowship. I don't know of anybody across the world I'm talking about. I don't know very few people who have not got into a program. So you just have to express a desire, and then it will happen. We will guide you. There are other people out there who will guide you, and we'll make sure that it happens. Okay? All right. Now questions. I don't know how long I've been speaking. I've completely lost track. Yeah? I'm happy to take questions.
Sir, Shashikiran, yes.
Yes, Shashikiran. Before that, is it making sense what I was saying? Was it worth knowing some information, or was it all a bit too much?
It completely made sense. Actually, there's a lot of details that you told us. No, it was actually, I think it is very tailored to us, because you're talking to the advanced stuff, that including the one even related to visa and other opportunities.
So tell me now. So ask your question.
Yes, sir. You're as I was learning yesterday, we told us about the certificate course that should be done, right?
Just speak up a minute, because somebody is making. I can't hear clearly. Just speak up a bit, please. Come close and speak up a bit.
Yes, sir. Yeah. You're talking about the basic robotic certification course, right? So yesterday about that. Are there any specific places that it has to be done, or I can search online and apply for it anywhere?
In India, they do it at Kochi, and if you want to go internationally, then Hamburg. Sorry, not Hamburg, Hamburg.
Okay, sir. Okay.
Yeah, in India they do it at.
Okay. Sir.
Yeah. Who else wants to ask?
Hello.
Yeah, who's that?
Sir Shilpa. I think my video is not visible.
It's okay. Keep talking.
Okay. Sir, I just want to know the one point personal development portfolio, the appraisals. What exactly the appraisals are? What do they exactly mean?
Shilpa, that is actually a whole different topic with a lot of details. If you look at my personal development portfolio, it is at least about 5 kilos. So it is something that we are taught during our training in the UK, and we all develop it quite rapidly. So I'll have to actually show you
Audible, sir, I'm sorry.
PDP. I really cannot.
Sir, you're not audible.
I said it is something that I will have to show you.
Okay.
It's a very, very big thing, and it's a whole big topic actually. One portfolio. If you want,
yeah, but I think that's a. Okay, sir. I feel that it's avoidable roadblock. Actually, I feel that it is also one of the very important prerequisite which has to be cleared.
What is? What is the?
I mean, I feel that it is also. I mean, prerequisite, like one of the very important prerequisites which is to be cleared is. I mean, that's what I have actually seen.
Yeah. We all have PDPs. I have a PDP, at this level.
Yeah.
And it is very, very important. It includes all my appraisals. It includes all my courses. It includes reflection log. There is something called as a 360-degree appraisal. So it's in the
Okay.
UK, it's a very professionally done thing, and we are all trained. Unfortunately, in India, you guys are trained to do it, so you don't know anything about how to write a PDP.
Yeah.
Actually, and when we sit in interviews, we
Okay. Okay.
candidate to come in with the PDP, and we actually go through the PDP as we are.
Okay, sir. Thank you.
Okay. Next, who else wants it?
Sir,
Okay, sir.
Shashikiran.
Thank you.
Yeah, thanks. Anybody else wants to ask me a question? Who's next?
Shashikiran here, sir.
Shashikiran again. Tell me, Shashikiran.
Sir,
Just speak up a
what
little.
about the logbook?
Logbook is a
Sir, do we need to have
sorry.
do
What
we
is
need to have a digital kind of a logbook, or if you have a physical copy of it, is it enough?
it's enough actually. You need a logbook. It doesn't matter whether it's digital or whether it's physical. Problem is most of us will have such a thick logbook that it's impossible to carry a physical copy with us. So that's why most of us go. The moment you go digital, you can actually then condense it, and you can do a lot of things with it. So my suggestion is, in this day and age, you should have a digital logbook. But it's okay if you have a physical logbook. That's okay.
Sir, Vikas here, sir.
Yeah, Vikas, tell me.
You mentioned about statutory and mandatory qualifications. Where can we find what are the things required for UK?
I'll send it to you.
BMJ.
To you, Vikas. I'll send you my copy of Stats and Man.
Okay, sir.
I'll send you.
And what is
Remind me, Vikas, when I get back. I'm
Yes, sir.
coming tomorrow morning. So just remind
yes,
me.
sir.
Yeah.
Okay, sir. And one off academic question: what would be average monthly cost for UK if you have to support yourself?
An average salary of an average guy, I'm not talking about a doctor, I'm talking about an average guy, is about 1,000 to 1,200 pounds. So I think 1,000 is a lot. For a single person, it's a lot. You can stay. London is expensive because of rents. Anything outside of London is quite economical, and around 1,200 pounds is enough to survive for the month. Not survive, live well in the month. But you got to remember that when you come in as a fellow or you come in into a job, we pay you about 6,000 to 7,000 pounds a month. After tax, you take home 3.5.
That's 5 lakhs.
You take home 3,500. And of course, as Indians, you will also do locums, and you will do weekends on call, and you will do extra on calls. So you can easily supplement that salary with another salary. So you can make 3.5 lakhs from 3,500 from the NHS job, and you can make another 2,000 to 3,000 from doing locums. So it's good money in the UK. But you have to work hard. It's not easy.
Yes.
You've got to work hard.
Hello, sir. Amol here, sir.
Yeah, Amol, bolo.
Sir, we want to know how to go about the FEBTS examination and fellowship, sir.
Is that okay? FEBTS ka requirement is that you need to be within a European country,
Yes,
and
sir.
you need to have done 100 cases.
Yes, sir.
The place where you will struggle is the experience in a European country. That is the only problem. Otherwise, FEBTS is the best qualification. So the basic requirement is just 100 cases. You have to have done 100 cases. Doesn't matter if it is all plural, VATS plural biopsies, or VATS CABG, or CABG, or all aortic valves. The requirement is 100 cases. They have separate for thoracic and separate for cardiac exams. So you can do either of the two. Okay.
Yes.
But the only problem is they specifically need training in a European country.
Yes.
It's EU or EEC, and that is where you struggle to get through the FEBTS exam qualification. But I am really fighting on the board of the ESTS to take away that qualification, take away that requirement. I am really, really pushing hard to tell them that, these guys are equally trained. And if you want international people to come into the society, then you have to open up the exam to international people. And if they don't do it, then we have been working on the Asian side to get a equivalent exam on FEBTS. But of course, we are running into some opposition from political issues and all that. But that's another story. Yeah, who's next? Is there anybody?
This is Tajdeed.
Who's that? Tajdeed. Tell me,
It's
Tajdeed.
Tajdeed here.
Yeah, tell me.
Tajdeed.
Yeah, tell me.
Tajdeed from Bangladesh.
Yeah, I know.
I want to know, is there any the international fellowship?
Speak again.
Hello.
I lost that.
Taking down. Hello.
Which fellowship were you talking about?
Yeah, I lost too. So, is there any age limit for these fellowships or worldwide? Is there any age limit?
Age limit? No. Most of the fellowships.
He's asking about the age limit, sir.
Yeah, there is no age limit usually. Some fellowships have age limits, which are usually the society young surgeons awards.
Yes, sir.
Various societies.
And how about the research? There are some.
But most fellowships don't have an age limit.
Okay, sir. And how about the research fellowship in thoracic surgery? There are some research fellowship worldwide I have seen.
Yeah,
Are there worth?
That's another ball game altogether. For research fellowships, again, to find a paid research fellowship is a big problem. Very few people have paid research fellowships. Korea and Japan and China are the only ones who have paid research fellowships. Again, you're only paid a stipend, not a salary. And also you need enough money to run your project. So the financial constraints are a problem. So research fellowships are a different ball game altogether. And if somebody wants to discuss that with me, feel free to write to me and I'll try and email back you and talk a little more about it. But research fellowships is a different ball game altogether.
Okay, sir.
Requirements are different for research fellowships. Next. Anybody else wants to talk to me? Nobody else wants to talk. Okay. So let us wrap this up. It's been a very long session we had. Yeah, who was that? Who's it?
So Dr. Irfana.
Yes, Dr. Irfana, tell me.
So Dr. Irfana.
Tell me.
Hello.
Yeah, I can hear you, Dr. Irfana.
Hi, sir. Actually, my scenario is little different.
Yeah. Yeah.
Yeah. I am from internal medicine department. I have done DNB internal medicine.
Yeah, I know that. Yeah. So there are.
How to go about it? Yeah.
One thing good for you, Irfana, is that I am locally available to you. So the first thing you have to do is to book half an hour with me or 45 minutes with me. Okay. I will be very happy to help you. Unfortunately,
okay, sir. Okay.
Tomorrow morning. So today was a perfect day. I was free all day. So in today from morning, we have finished doing Nikhil's thesis. So we spent about 5 hours and finished his whole thesis. You could have met me today, but next time I visit, make sure that you meet me. Okay. Irfan, I'll talk to you personally. I'll guide you on the physician side. Okay. Speak to Nikhil and make sure that you get a time with me. And I'll be very happy to sit down with you. Okay. Yeah. Next. Who wants to come on? Anybody else? So it's been a very productive day for me. We managed to finish through Nikhil's thesis today, which is huge help. This is a revolutionary study is done and proper prospective 3-group control and everything. Very, very good study. So I'm looking forward to at least 5 papers coming out from his thesis. And Dr. Bhushan also sat with me for almost an hour and a half and got all his CVs sorted. So, and then now I've spoken to all you guys. So very productive day. I'm very happy. I'm traveling back tomorrow morning, but this trip was worth it. So anything else you want to say? Anybody wants to say, or shall I sign out? Just quick feedback, okay? Don't talk about how good I am or whatever. Just talk about how do you think this is helping you. I just want 1 or 2 words from somebody. Just quickly, because I need to know whether we are making a difference or is it getting to be too much. Anybody want to lead? Who wants to lead?
Sir.
Who is there? Nobody. Okay. All right. So I'm going to call an end to this meeting, and then we will hopefully.
Sir, Shashikiran.
Shashikiran, yeah, Shashikiran, tell me. Shashikiran, is there anything
Yes,
different?
it's actually making a difference because
No, the reason I'm asking this is, should we do it in any different way? Should we do it? Shashikiran?
I think for me, I think it's sir. This is all brand new information actually.
Oh, very.
So many details that are there. So
I am actually very
for
happy.
me, I think
I'm very happy with that. That is quite important. I'm happy to.
so because these as you told,
Sir, one big reason
as
I never got enrolled into a fellowship. I did not know where to look for it, whom to ask guidance. Few of my friends, they have been guided with, so your guidance will be really good, really helpful. I'll write to you, sir, especially.
So I hope I've encouraged you people to apply for
It is
fellowship.
making a big difference, sir.
Good. I'm happy with that. I'm quite happy with that. Okay. All right. Thank you very much, everybody, and good night.
actually I was of the mindset that applying to UK is a very difficult job. You'll have to go through a lot of steps.
No,
So
no.
you have streamlined the things that has to be done. So
Yeah.
we have a path actually to
Yeah.
see forward for.
I think what I'll do is I'll draw a line diagram and send it to all of you guys, so you sort of know what is the requirements and how to prepare for it. I'm quite happy to share this presentation online as well. Okay.
Sure, sir.
Sure, sir.
Thank you very much, everybody, and good night. Okay. It's been.
Sir, and what about the
Sorry, what was that?
imaging class, sir?
I was happy to do it on.
So the imaging class
I invited everybody to
you were also talking about.
Nobody wants to come. What can I do? For imaging, you need to be in front of me. No, I was happy to do it on Tuesday. I even put the program out there, but nobody responded. So I unfortunately cannot do it this time. Hopefully, I'll do it next time. Okay.
Yes, sir.
Hello.
Yes, sir. Thank you, sir.
I'll try and do an online imaging class, but it works very well when you're in front of me. It works very well because if you're in front of me, I can go bang, bang, bang. I can put up 100 CTs quickly and we can go through it. Online, I have to slow down.
Sir, how many people you want to be present in Medanta, sir, for this imaging class?
As many as possible.
No, minimum, sir.
Minimum 1.
So next time you are in India, sir, I am definitely that 1%. Definitely, sir.
More than one were ready.
No. You will be the second. You will be the second.
No.
Because
Nikhil Rane has jumped